Hi everybody, my name is Karen Fabian and I'm the founder of Bare Bones Yoga, and I wanted to do a quick video today about myofascial release. Now I'm going to explain as I'm moving through the practice a little bit about what it is. What I want to do first is talk to you about the tools. Now the first time you're watching this, you may not actually have these tools available. They're really easy to get. You can get them online. And so perhaps what might make sense if you don't have the tools at this point is to just watch the video, get a sense of it, and then order some of these things and then come back to it. So I think a good idea at this point versus the long one is just a short foam roller. And I got this one from Trigger Point, which I really like because it's got kind of the indentations on there, and I'll explain the role of those in a moment. The other thing to get are myofascial release balls, and these are from Rad. Another really good brand is Yoga Tune-Up, which is Jill Miller's company. If you're familiar with Jill Miller, she's a fabulous yoga teacher and expert in myofascial release. And there are other brands as well. The one thing I would just warn you about is if you don't get MFR balls from a company who specializes in it versus if you just go on Amazon and pick something at random, they might be really hard because they might just be lacrosse balls covered with rubber. So these have a very different kind of density to them, and they give a little bit. And you want that give because you don't want to be pressing into your muscles and have something that doesn't give a little bit when you use the compression technique and even the rolling. So be sure you're getting, I would say again, Trigger Point, Rad, Yoga Tune-Up. Those are some good brands, and you can get them all online, so you don't have to leave your house. Okay, so here's what we're going to do first. Let me just tell you just really quickly a couple of things about myofascial release. So the idea here is to use a tool to apply pressure and other techniques to the body, specifically designed at getting to the fascia. Now, if you're unfamiliar with what fascia is, you of course know that the infrastructure of the body starts with the bones. And then there are, and I pretty much guess most people would know this, muscle around bone. And then you may even be familiar to a certain extent with tendons and ligaments that support the connection between bones, which are the joints. Well, in addition to that, and something that's really not often even discussed in yoga teacher training when teachers are taught anatomy, is what is fascia and what is the role of fascia. So you can imagine fascia as a connective tissue layer, and it's really more than a layer because it goes in between and around all your organs, bones, and muscles. So it's a completely supportive structure. And it's connective tissue, which is different from muscle, meaning it's not vascular, it's not supplied by blood. It has other sources of structure, and it keeps a sense of buoyancy in the body, so it prevents our bones from literally crashing on one another or having so much pressure there. And it also provides for fluid movement. However, because fascia is in part comprised of collagen fibers, and I'm kind of making this, you're probably wondering what that is. So the direction of healthy fibers in healthy fascia is a wavy pattern. But oftentimes, if people sit in a way that they kind of, hold their bodies in a strange posture, different from, kind of an ideal anatomical position, that wavy pattern in fascia can get disrupted. And furthermore, let's say, like I had my appendix out, let's say there's some kind of surgical scarring. There can be scar tissue that forms and additional damage to those fibers. And additionally, if you have just other kind of cumulative movement injuries, let's say you're doing something all the time, or you're working in a job that requires you move in a particular way regularly, or you have a certain posture that you hold all the time. Those kinds of movement patterns can also create disruption in those fibers. And that oftentimes shows up as a part of the body where you might just feel a knot. And sometimes people call this a trigger point. So I want to start to use some of the techniques so you can see how this all comes into play. The other thing I'll just point out to you is the benefit of the different techniques that we're going to use today with the roller and the balls is to try to restore some of that healthy wavy pattern and break up some of those areas where the fibers are, the collagen fibers are out of sync with their normal wavy healthy pattern. It's also to try to stimulate some blood flow and try to move some fluids in and out of areas where there's a problem. Because when there is a problem, the body recognizes it and the cumulative injury cycle starts to kind of go into play in a particular area. Let's say you had a shoulder injury, and that's where you might see some swelling. And so your instinct might be, oh my goodness, I need to put ice on that. But actually, when you think about it, what we'd like to do is create more circulation to help that injury process begin to do its job, rather than apply ice and freeze everything in one spot. The other really great advantage of rolling is that there are receptors in the body that are in muscles and at the point where muscles connect to bone. And these receptors communicate with the nervous system about what's happening in the muscles. And sometimes if muscles are constantly tightened, the messages are always going back, we're having all this increased tone. And as we use these different techniques, it can calm some of that tone a bit, and some of that messaging can start to trigger the communication pathways between the brain and these muscle receptors to calm down a bit. And that can create a sense of calm in the body in areas where people might feel tight. And sometimes it's not even something they're aware of. The other thing I'll point out is, in the exercise science world, and I'm trained as a personal trainer as well, we actually do this in the exercise plan before we have people move. Keep in mind, in yoga classes, we're not doing anything like this before we ask people to move in a dynamic way, as well as hold static stretches, which essentially are what yoga poses are. This is one of my big kind of beefs about yoga. The more I learn about myofascial release and the more I use it with my students, with my online teachers in my Blueprint Learning Program, I teach them the techniques, and in my own body, I really, really am a huge advocate for yoga classes offering MFR in the first 10 minutes of every class to apply some of these benefits and to really prime the body so that students can then begin to move with a little more ease. So anyway, I don't know if that's going to happen, but that certainly would be something I would like. So let's do this. First, we're going to come down and we're going to lie on the back, and we're going to get at a part of the body on the back called the erector spinae muscles. So I'm going to just come into feet flat, about hip width distance apart, and I'm going to support my head a little bit, and I'm just rolling here. So the rolling that I'm doing is specifically on the lumbar spine, and this can be an area where the erector spinae muscles can get really overactive. And in part, it can have to do with the relationship between the core musculature and the lower back. But in many people, if you see kind of this overarched back, kind of a sway back, it can be that those erector spinae muscles, which align the spine, are a little overactive. And so creating some rolling patterns here can start to calm some of that. So I would do this rolling about 30 times. And notice I'm not doing it super fast. I'm doing it kind of slow, supporting the head. So you can do this. I'm going to kind of abbreviate some of these things just for time purposes, but I would say about 30 times there. And then I'm going to set my hips on the ground, and I'm going to start to arch over a couple times. And I'm going to do it in this spot here. Right, I would do this about 3 to 5 times. And then I'm going to move up a little bit. So you'll notice here, I'm really working through my thoracic spine, which is the middle part. And you've got those 12 thoracic vertebrae. And that can be a part of the body where it's pretty stiff just by design, right? So you can see you've got the thoracic cage there, designed to protect the heart and the lungs. But the stiffness there can create some stiffness in the body. And certainly our twisting yoga poses will get to that. However, this can really help. And the other thing that this does is, You know, in our typical movement patterns during the day, we don't do spinal extension all that much. We certainly do spinal flexion when we hunch over our desks, but we're not really doing spinal extension, and you'll see that in people when they have challenges coming into wheel. So this starts to strengthen the erector spinae muscles in this pattern of movement where I'm moving into extension, especially through the thoracic spine. So I'm not really doing it in the lumbar, and I'm definitely not doing it in the cervical spine. You know, there's way too much cervical extension happening in yoga classes, people throwing their heads back a lot. So here I'm really just working the extension and the focus on strengthening spinal extension in the part of the body where I really don't get a lot of that in my day-to-day movements. So that's kind of one focus there. Now, the other area that I know can be a big problem for folks is the upper back and neck. So we're kind of looking at this area here. So here we have muscles like the trapezius, which start on the occiput, which is at the base of the skull there, and it fans out and lands on the scapula and then goes all the way down through those thoracic vertebrae. So when you look at the shape of the trapezius, the upper trapezius elevates your shoulder blades, the middle trapezius squeezes them together, and the lower traps drop the shoulder blades. That whole muscle can get kind of tight and discombobulated. So here I've taken away my picture so I can put the balls around my spine, my cervical spine, and I'm just going to use some pressure here. So when we use the MFR balls, we're using a lot of different techniques. Here I'm just using compression, and if you think back to what I talked about at the beginning, I'm just using pressure, compression, to start to disperse if there's any kind of fluid that's kind of stuck in the interstitial space, which is the space between the tissues. I'm trying to use some pressure to try to calm some of those muscle receptors that I was talking about before. These are muscle spindles and Golgi tendon organs. We don't have to get into all that, but just kind of so you're familiar with some of the names. And so you can use pressure in a bunch of different spots, right? I'm not going to go through all of them, but you can kind of get the idea. Now, one thing you want to remember is you don't want to put the ball on bone. So I don't want to be kind of pressing into this little ledge of the scapula. You know, in this part here, it's kind of hard not to get a little bit of pressure on the scapula because of where the ball is. But you don't want to feel like it's right on the bone. I wouldn't put it right on my kneecap, for instance. There's not going to be a ton of benefit there. You're really looking more for soft tissue, which is fascia and muscle. And let me just say too, even though these tools are designed to work fascia, obviously we're getting to the other stuff too. It's all living there in the same space. But these techniques are specifically designed to aid in fascia. So you can kind of take this all the way down the back. The other technique though I want to show you is that you can also kind of lock the ball in place with your body weight leaning against it and start to move your arms a little bit. And this really changes the sensation because now you've got that ball locked under there and you're moving the proximal limb, the limb closest to the ball. And so this can generate some different sensations and some different benefits just because now we're using movement in addition to compression. So that's another thing. And then of course, similar to the foam roller, you can do rolling. And because you're up against the wall, you can get some different techniques going. And you're really just using, this is a very kind of personal practice. And you know, because you're really using sensation as your guide, it's really a way for you to tap in. It's very meditative to tap into how things feel in your own body. Obviously, if you feel pain, you wouldn't want to do it on an area there. If you have an open wound, if you have any kind of vascular issues. So there are some contraindications to myofascial release, and I would kind of encourage you to check with your physician if you have any complicating factors before you start using MFR as part of your home care, self-care. So that's an area there. Now, you'll notice this worked a lot better on the wall because I have the freedom to move. You can definitely do this part of the body and work your way down on the floor. I just find that it's easier to do some of these things on the wall. Now, the next thing I want to get to is the gluteus maximus. And so the gluteus maximus is the big part of the glutes. The glutes are 3 parts, maximus, medius, and minimus. And so the gluteus maximus covers this whole back surface of my pelvis. So I'm going to take both these balls and I'm going to put them underneath. I could do this up against the wall as well. And I could do it unilaterally. And here I'm doing it bilateral glute max work here. And I'm just using compression, right? So I'm kind of right in the center of that muscle, which covers the whole back of the pelvis there. And then I can definitely use some rolling. And you know, when you look at a picture of any of the muscles, you'll see the direction of the fibers. And so you can work in a way with the ball that works with the fibers. You can work across. So those will give you different sensations as well. Again, for time purposes, I'm not going to do, you know, kind of as much as I normally would do, but you kind of get a sense here of what you want to be focusing on. If I do it with one, I could just do a figure 4 and kind of get in there as well. And then I could also do some of that pin and stretch and just move the proximal limb, move the limb closest to the ball and see if that creates any different sensations. Okay, so the other thing I want to point out is this is a really great way to learn the muscles. So if you have my anatomy manual, it's a great thing to go through page by page, muscle by muscle, and roll each muscle. Great way to learn. If you're interested in the anatomy manual, it's on my website, barebonesyoga.com. So you'll see now I'm going to the lateral aspect of the leg. So this is the outer leg, and this is where the glute medius lives. I'm actually going to just do one ball. So I've got this kind of pinned under there. Okay, now your gluteus medius is in part an internal rotator on the front side, the anterior side, and an abductor on the mid side. And I'm just kind of getting in this little spot here and using a little bit of pressure and rolling. And this can be kind of a interesting part to notice. Now, the glute medius turns into the tensor fascial lata and the IT band, the iliotibial band, which runs all the way down to the knee. And so these are all lateral leg stabilizers responsible for helping you keep your pelvis level when you stand on one leg. Now, as you continue with this down here, you're going to get eventually to where the IT band attaches to the knee itself. And this can be an area where it can be good to do some movement, because think about it, if you're a runner, you're constantly doing this, and that can create a little bit of, you know, kind of overuse right in that area where the IT band connects to the lateral aspect of the knee. So this can be a good area to do this on. Now again, I know sometimes people say, oh, you're not supposed to roll your IT band. You know, we have to use kind of moderation with all of these things. We don't want to kind of force or plow these balls into our body. We want to do it in a way that's not overuse. But, you know, I don't really know of any reason why we wouldn't want to do it on that part of the body and do it on other parts. Sometimes I wonder where these warnings come from. You can also use the foam roller as well. I just feel like it's a little more diffuse and might give you some different sensations. But you can see how I can do pretty similar techniques, but it does require a little bit of coordination of the body. So depending on what's easy for you to maneuver, you can kind of decide what you want to do. The other one I want to show you is the quadriceps. So you've got 4 aspects of your quads, and one of them crosses your hip, your rectus femoris, and that's your hip flexor, and all the other quads are your leg straightener or your knee extender. So if you come down into this kind of sort of pigeon pose and you put the ball right in the middle part of your leg, and you can put 1 or 2, and then you start to move the quadriceps through its action of concentric contraction, eccentric lengthening, right? So when the leg is straight, quadriceps is concentrically contracting. When the hamstrings are working to bend the knee, quadriceps is eccentrically lengthening. So you're taking it through its pattern, and then you're moving in such a way that you're going up the leg. So as I move down, I go up. And I can do this also on the outside and the inside. Because remember, you've got, for your quadriceps, you've got your vastus intermedius, medialis and lateralis, and rectus femoris, which is the one that crosses the hip and also is a hip flexor. So you can take that pattern down the midline, lateral aspect, medial, and then up into the hip. So the last one I want to show you, and there's like probably hundreds more I can show you, but for purposes of time, is the plantar fascia. So right at the bottom of the foot is a very thick band of fascia, and thank God, because it supports the weight of the body. It can also, if you've ever had plantar fasciitis, be a part that gets really tight. So you can use some compression on different parts of the foot. You can also use some rolling, and don't forget about your heel. And then you can also do a little bit of dexterity work and squeeze the ball as well. And you would do that obviously much longer than what I've done there, but that gives you an idea. So that's a quick pattern. And another thing that I would say is, if you have a hard time sleeping, myofascial release can really bring down the tone of the muscles in your body. And so even just doing a 20-minute or even a 15-minute MFR session before you go to bed can really be helpful for decreasing muscle tone and just kind of bringing down kind of an amped up system. So if you find that you're struggling with stress or anxiety, this can be, and meditating, let's say meditating is hard for you, this can be something that can be really helpful in that regard. So I want you to keep in mind that I have a whole module on myofascial release, much more information than what I've shared here, in my Blueprint Learning Program. And this is my premier learning program for yoga teachers to help them learn anatomy and really in an overall way bring more confidence to their teaching, because they're really understanding what's going on underneath the skin, and it can really help them help their students more, which on a big picture level helps them grow their impact. So if you're interested in a program like this, all you need to do is go to my website, barebonesyoga.com, and right on the home page you'll be able to get on the waiting list, so the next time I open enrollment, which is coming up soon, I do it every few months, you'll get notified with a special opportunity to enroll in the program first, because I usually limit how many teachers I enroll every time I open the course, because I want to be able to support them as they go through the program. So again, just visit my website, barebonesyoga.com, click the link on the home page, you'll get on the waiting list. There's no obligation, it simply means I'll let you know when enrollment is open. So I hope you've enjoyed this. I hope you're well. Stay well. If you have any questions, feel free to comment here on the video. And don't forget to click subscribe, because I'll be doing a lot more videos these days, and I want you to know when the next one posts. Have a great day.